Doctors wash their hands because hands can carry invisible life from one person to another. In a hospital or clinic, that small movement can decide whether a patient heals safely or develops a dangerous infection. Hand washing is one of the simplest actions in medicine, but it is also one of the most important. The reason is germs. Bacteria, viruses, and fungi can live on skin, medical equipment, bed rails, phones, doorknobs, and clothing. A doctor might examine one patient, adjust a chart, open a door, and then touch another patient. Without hand hygiene, germs can travel along that path. This matters especially in healthcare because patients are often vulnerable. Some have open wounds. Some have IV lines or breathing tubes that give germs a direct route into the body. Some have weak immune systems because of age, illness, cancer treatment, surgery, or medicines. A germ that might cause little trouble on healthy skin can become serious if it enters the bloodstream, lungs, or surgical site. The history of hand washing in medicine is powerful. In the 1800s, a doctor named Ignaz Semmelweis noticed that women giving birth were dying more often in one hospital ward than another. He connected the deaths to doctors who moved from autopsies to childbirth without cleaning their hands properly. When he required hand washing with a disinfecting solution, deaths dropped sharply. At the time, many people rejected his idea because germ theory was not yet widely accepted. Today, his lesson is basic medical practice. Hand washing works because it removes or kills germs before they spread. Soap and water lift dirt, oils, and microbes from the skin so they can be rinsed away. Alcohol-based hand sanitizer kills many germs quickly when hands are not visibly dirty. In healthcare, workers use both methods depending on the situation. There are key moments when hand hygiene matters most. Before touching a patient, before a clean procedure, after exposure to body fluids, after touching a patient, and after touching the patient's surroundings. These moments are designed to protect both the patient and the healthcare worker. Hand washing is not perfect by itself. Hospitals also use gloves, masks, sterilized instruments, clean rooms, vaccines, antibiotics, and infection tracking. But gloves do not replace hand hygiene. Gloves can have tiny defects, and hands can be contaminated while removing them. Clean hands remain the foundation. Doctors wash their hands not because patients look dirty, but because germs are often invisible. A person can carry microbes without symptoms. A surface can look spotless and still hold bacteria. In medicine, safety depends on respecting what cannot be seen. So the answer is simple and serious. Doctors wash their hands to break the chain of infection. It protects the next patient, the current patient, the medical team, and the wider community. A few seconds at a sink or sanitizer dispenser can prevent days of illness, months of complications, or even a life-threatening infection.